Hi, we are, today is the 26th of June and we are in a public meeting. And we're looking at the regulations restricting tobacco and vape products. And I'm calling this meeting to order. Hi, I'm here, Carrie Mimmitz.
John Romano.
Yeah, okay, so.
Carrie, I'm just pulling up.
I'm just looking at what you said.
Yeah, what I sent you.
Trying to make heads or tails of it.
So this is the first time that we have done a public hearing. So we are going to follow a little draft form to explain so we don't miss anything, and we're complying with public meeting laws. So I'm just pulling that up now. Okay. So before we begin taking any testimony, in the interest of time, we ask that you adhere to the following ground rules. Any person wishing to make a comment should sign in or raise their virtual hand. Before addressing the Board of Health, please be familiar with the proposed regulation. When addressing the Board of Health, you must first identify yourself by name and any professional affiliation you may have that impacts your comments. Identify the section or proposed policy or the proposal that you wish to comment on. Please limit your comments to 3 minutes so that other members of the audience will have a chance to speak. Please be considerate of those persons speaking, whether you agree or disagree with them, and refrain from commenting out of turn. Any person showing verbal disrespect to those speaking will be asked to leave the public hearing. We are recording this meeting. If anyone else is recording, please let us know at this time. Okay. And I was hoping that we could start the meeting by introducing Meredith O'Leary. Let me just see if some is unmuted. Looks like everybody's muted now. So Meredith O'Leary is the coordinator for the Pioneer Valley Regional Tobacco Coalition, and I was hoping that she could give us some words of wisdom.
Sure. Hi, everyone. Hi, Greenfield Board of Health. And Meg, thank you for the introduction. As Megan said, I'm Meredith O'Leary. I am the Pioneer Valley Tobacco Coalition Coordinator, and I also am the City of Northampton Director of Health and Human Services, Health Commissioner. So I play dual roles. I've been working in public health for about 20 years, and I've been leading this coalition probably for the last 7 years as coordinator. My role as coordinator is to help boards of health move policy along. Here in Greenfield, Meg has been doing an amazing job. I commend you. I just reviewed the draft regulations earlier this week, and they're excellent. They're all inclusive. The reason that we have these model regulations in a checklist is for boards of health to make decisions as we have the authority to have home rule here in the state of Massachusetts to make decisions what policies fit best for your community and are culturally sensitive, are appropriate for your businesses, appropriate for public health. So you have the autonomy to do so. And again, you were very inclusive of all the suggestions, which help reduce youth initiation when it comes to tobacco use. Because as you all know, we have been playing whack-a-mole with big tobacco for forever, since the early 90s when we decided to have smoke-free workplace regulations. I feel like they've been always 2 or 3 steps ahead of us, and we are just trailing behind trying to defeat the marketing tactics and the the strategies they have to get youth initiated into using tobacco and nicotine. So with that being said, I'm here today just to provide you any support or technical assistance that you need. I looked at the posting for the public hearing. That was all done properly. So at this point, I think I'll just leave it to you. If you have any questions for me, I'll just put my mute on and listen to you. And if you have any asks, I'd be willing to answer them.
Thank you, Meredith.
You're welcome.
Harry and John, do you have any questions at this time?
No, I don't have any super specific questions. I think the only thing that, is on my mind is that we had passed around sort of the tobacco regulations in the past. I think we had, in our latest draft, kind of upped the sort of penalty for second offenses. I don't know how significant it was, but I think it was somewhat significantly to deter these. And I was just curious if there's any evidence or if there's any research done on how effective that is to to increase the penalties, particularly for second offenses and third offenses on actual behavior of these places that sell tobacco. I'm just curious, if there's been any studies and if there's particular goals that maybe we should be targeting for those sort of punitive measures.
So is that question directed to me?
I guess unless
Okay.
unless Michael's seen anything, or just figured I'd ask him if anyone knew in
Sure.
particular.
On my end, your audio went out a little bit. I'm not sure if it did for everyone else as well. But I think what you were asking is, in previous regulations, the penalties weren't as steep as they are currently as prescribed in this new draft regulation. Is that the question you were asking?
Yeah, and I just was
And
curious
is
if
there, right,
if there's
is it
particular
evidence-based?
benchmarks
Yeah, yeah.
that are recommended, that are evidence-based, that we could adhere to, or if
So if we go down to the penalties section, let me just scroll down there in the draft. We have violations, and in the first case, okay, so in the first case, it's, your local regulation prior to said, I believe, $100. I think yours prior to was 100, 200, 500. I don't have your old regulation offhand. I reviewed it a while ago. And here we're seeing now it's 1,000 and a suspension period from 1 to 30 days, which you will set. And then the second offense is 2,000 with a 7-day, and then 5,000 for 30 days. So that is required by the state. So those penalties that we're seeing, we are not allowed to reduce them because they are the state penalties. But if you read closely, it's the penalty 1,000 and the suspension is for a sale to a minor. It's 1,000 for any other state violation, but the suspension is specifically for the sale to the minor. What we have found in tobacco control is the merchants are very willing to pay the steep penalties, the fines. What they're not willing to do, or they really are pleading at any hearing that I've gone to, is to reduce the suspension period. That's where it really hurts financially. There are other communities that actually took out the tolling period because the tolling period is 36 months. So the clock starts over, during this tolling period, where some communities say, after 4 egregious offenses, like you shouldn't, having a permit is an honor. And after 4 egregious offenses and a sale to a minor is very egregious, you shouldn't be given the honor to have a permit. So we don't like that tolling period. So some communities have done that as well. So again, it's not so much the fine that we find, but the suspension really kind of hurts them financially. And hopefully that's lesson learned. Now, is that evidence-based? I don't have any data for you to support that, but I'm certainly willing to do a little digging and to see if it's supported.
I really appreciate that answer, and that's kind of my impression, that the suspensions really what hurts. And I think when we had reviewed the draft last, like that was one of the things we'd increased for the second offense, or maybe it was for the third, I can't quite recall, but I really appreciate that perspective. That's really helpful.
And then if you look, your local regulation has other strategies included, but again, if there's a violation with the local strategies, the fine is much smaller.
Anyone else have any specific questions they'd like to share? Carrie, are you talking to us? I think you're muted there.
Yeah, I was just saying, I think at this point, we are going to open it up to public comments. We'll make a motion for public comments at this time.
I second the motion.
I too didn't do it in the beginning, but yes. So anybody have any comments at this time?
Meg, you got one with a hand.
Go ahead, Stephanie.
Hi, Stephanie Duclos, 166 Chapman Street, here in Greenfield. I was looking at, quickly scrolling through the draft proposal, and I was wondering if this is a change to a current law and regulation that we have, or bylaw we have already on the books of Greenfield. If so, if there are changes, is there any way to delineate, like by strike through, what the changes were? Or is this just a brand new regulation that's going to be proposed before the city council?
So this is just a amendment to what we already have. A lot of these regulations are already in there. And then it's just the things that we have added are just the things to align with the state law. We also took out some words like may and changed them to shall.
Those are pretty substantive changes when you make a regulation from a may to a shall, because it means that you must enforce it or they must adhere, and then there are penalties, and that actually has to go through kind of a legislative process. So I didn't know if this is like being presented after this meeting to another entity like the city council.
I am not quite sure.
No.
The may, the may and the shall that has changed is part of the state regulation. So the state regulation says you must do a suspension from either 1 day to 7 days and have a $2,000 fine, say, for example. And so we changed it to shall have a suspension for 3 days. So it's still that they have to have the suspension, and we just put the day, and that was on one regulation. I can tell you which one it's one of the sale to minor ones. But go ahead, Mike, and you can.
Yeah, so the changes are just to adapt what the state law, to be in line with the state law. It doesn't go to any other legislative body. The Board of Health can enact these regulations by itself. So we are just adopting what the state has already. So we're just making some changes to go into line with that.
Is there any way that sorry, echo. Is there any way that you guys can kind of like highlight on your document the changes you guys have made, just so that, like, I'd like to be able to compare them. I just don't want, like, I know that Jaduke is moving in across the street from a tobacco retailer, and I don't know if, like, will one be forced, to abide by a regulation, within a school zone or whatever, if they were established prior to the allowance of a school in the same proximity. I'd like a highlighted, what you guys have changed. That would be great. Thanks.
Yeah, we can certainly get you a draft with the changes highlighted. If you just want to email us at some point, we have a draft, Megan. I know, I seen it, so we can certainly email. So if you email me, we can certainly email you a draft with the specific changes that are happening.
That would be great. Thank you.
Yep.
Other public comments?
I don't see anything in the chat, Megan.
Yeah.
I don't see any more hand raised.
I just saw a hand.
Oh, did you? Okay.
I think I did, or a chat. Not a hand, a chat.
Oh, okay. Oh, she
Oh,
was
nope, that's
sharing her
just
email address.
Stephanie's email.
okay.
That's fine.
All right.
I can send that to you.
Okay, whoops, let me close it. All right, so at this point, I'm making a motion to close public comments. Carrie Mehmet's aye.
I second the motion, John Romano, aye.
All right, so at this point, we are going to make a motion to adopt the proposed amendment regulation to restrict the sale of tobacco and nicotine delivery products and the proposed amended regulation prohibiting smoking in workplaces and public places. With this effective date of June 26, 2024. I'm going to say aye to this. I do not oppose it.
I do not oppose either. All right, I suppose the motion
Motion
passes
passes.
then.
That motion's passed. Sorry about that. All right, so I guess at this point, we are going to close this meeting and move on. Are we doing the regular Board of Health after this? I apologize. Okay. All right, so I'm making a motion to close this hearing. Carrie Mehmet's.
I second the motion.
Okay.
I vote aye as well.
Okay. So I will reach out to both of you to find a alternative date in July that we can both meet. I know you're busy, Mr. Dr. Romano, tonight, and that's fine. So I will get out another agenda. We'll post it on the calendar, and hopefully in the next coming weeks, I'll try to make it maybe earlier in July then, so we can kind of make up for the one that we didn't have tonight. All right, does that sound good?
That sounds good. Yeah, and I apologize. I had some schedule changes that I kind of forgot about. So
That's all right.
I'll just
Things come up. We understand.
I appreciate it.
All right.
Thank you.
All right, good night, everyone.
Thank you, Meredith, for coming.